Hi, welcome back to the Doula channel. I'm Renee Corner, and the exciting thing is I have my first two guests with us as we go into talking more about pregnancy, childbirth, postpartum, and even newborns. So my first two guests today are going to talk with you guys about the benefits of chiropractic, not only for some of your pregnancy woes, but also during the birth and for your newborns. So I'd like to welcome you back and introduce my two guests today. So with us, I have Dr. Mindy Gentis.
Hello.
Thanks for being here.
You're welcome.
Also, Dr. Yvette Castro, soon to be Johnson, if she doesn't become a runaway bride. So welcome.
Hello.
We had a huge conversation before we even started filming about how informal but professional we're going to make this. We have a great time when we get together. There's lots of laughs, so you'll see that portrayed today. But also we're going to get across the very professional message of how this can benefit you and your family. So I'm going to start how I do with everything. We're going to talk about pregnancy. We're going to talk about labor, birth, the immediate postpartum, then we're going to talk about newborns. So Dr. Castro, should I call you Yvette or Dr. Castro?
Yvette.
Okay. So Yvette, let's talk about some of the pregnancy woes. What are some of the common complaints that you hear from your patients when they come into the office?
So the number one complaint that comes through is low back pain.
Okay.
Low back pain, a majority of patients are coming in for low back pain. Most of the time there's something that is also present with the low back pain. They might also have hip flexor tightness and pain, but the low back pain is always the primary concern that they come in for. Rib pain is another really common one. Pubic bone pain, tailbone pain, neck and shoulder pain, headaches, all of those things are really common at all stages of pregnancy. They always tell me they go to the OB. The OB said, oh, well, this is something that'll just go away after the pregnancy. And they don't realize that there is treatment options available for them and that they can get conservative care throughout their pregnancy and have a more comfortable pregnancy and make the labor and delivery easier.
Yeah, because they're told this is normal. This is normal discomfort for pregnancy. Just cope with it.
Sure.
So what you're saying is they have options.
They have many options.
And so obviously chiropractic care is one of them. Is it just adjustments that you do?
It's not just adjustments. Okay. We do some manual adjustments. Sometimes an activator adjustment will also be implemented. Okay. I don't personally do activator. I only do manual adjustments. Okay. But I do refer out for people that like the activator treatment. In addition to the adjustments, I also do soft tissue work. That's a big bulk of their treatment when they're with me is I spend anywhere from 30 to 45 minutes hands-on with them, assessing the soft tissues, muscles, ligaments, etc., to figure out where these restrictions are, what's pulling on the pelvis, what's causing these little aches and pains that they're having.
Sure.
So sometimes they'll come in and say, oh, I'm having something in the lower back, and as I feel around, it's not the lower back. Where the issue is. Something's pulling in the mid-back, something's coming from the neck. So with that being said, I feel that the soft tissue element is a really, really big piece for pregnant women, not just the adjustment. The adjustment is great to help with the alignment of the pelvis, to make sure everything is balanced, to be able to create a good space for the baby to come through, to get the baby in a good position for labor and delivery. But if you don't release the soft tissue restrictions that are around the pelvis, they're not getting all of the benefit they can from chiropractic care. There's tons of muscles, ligaments, different things attached. I've got the pelvis here. And sometimes what will happen is when you've got the hip flexors, they come down right through here, and you can see baby comes in and out. If you have a muscle that's really, really tight coming through here, there's not going to be enough space. There's not going to be enough room for the baby to get in the position that they need to. Sometimes you'll have the ligaments. So there's sacrotuberous ligament, if you can see that back here. Sometimes if these ligaments are too tight and pulling, you're going to start to cause misalignment and imbalance in the pelvis so that when the baby's trying to come through again, they're not going to have balance here in space to get everything, through.
Is that
quickly.
why women waddle in pregnancy? You hear about that pregnancy waddle.
Right,
Is that what's
right.
going on here?
Some of it is the hypermobility in
Okay.
the joints. They're trying to stabilize everything. They've got all of that relaxin and progesterone and estrogen running through their body, and it's like, whoa, all this stuff is loose. Like we need to stabilize. So you'll see a little bit of the waddle there. Sometimes they're waddling because there's pain. Sometimes they're waddling, because they're feeling pressure.
Yeah.
They try to get the legs out of the way to make space for the belly. So, you'll see a pregnant woman reach down, to pick something up off the ground, and they'll, move their legs out of the way, squat down, pick up whatever they need to. But with that, you're going to get tightness and activation of the piriformis muscle. So that's another reason that the muscles are so important to address.
The soft
during
tissue that
pregnancy.
you're talking about, right? So we have the hard tissue, obviously, which is
Right.
the pelvis itself,
Yeah.
that we know is very pliable to
Very
allow
pliable.
baby to get into the inlet and out of the outlet of the pelvis. So that hormone kicks in definitely towards the end of pregnancy, the relaxin hormone.
Yes.
So that can be pliable. But what you're wanting to do is make sure that they're set up for the greatest success.
Right.
So everything's in alignment. Baby can drop down into the pelvis and navigate the birth easily as well, right?
Absolutely.
That's so important. And I don't think we talk enough about that.
No. That's, I think, one of the unspoken things that, there isn't enough information out there. Women don't realize how important it is to have their body prepared for labor and delivery. I read a study just a couple days ago. They say that chiropractic care can reduce labor and delivery time 25%. 25% is huge. I mean, you're talking a 24-hour labor going down to 18 hours.
And then add to that. Well, exactly. And add to that where doulas help decrease the amount of time that women can be in labor.
Right.
Because we have them up, we have them moving, working with their body and with the adjustments that you've made, and allowing gravity to facilitate some of that too.
Right.
So, I mean, this is honestly just setting them up for a successful, amazing birth.
Totally.
I'm all about that. So what about adjustments in labor? Do you go to their homes or to the hospital? Have you done adjustments in that setting?
I have. Hospitals, home births, birthing centers. So adjustments during labor, they're just as important as during the prenatal period. And just because you didn't go to a chiropractor throughout the pregnancy doesn't mean that you can't benefit from chiropractic care during labor. It's not too late. It's never too late to get care. So what we do is we get called a lot for adjustments when the position isn't quite right. You might have a posterior baby. You might have an asynclitic baby. You might have a baby that just isn't quite vertex.
And that causes for longer labors, right?
And so without that, you're not getting the good pressure to get the dilation, to get things moving along. So those women will be told your labor stalled, and
failure to progress. This is a term, a medical term that we hear often. That might be a reason to go into the operating room or for a C-section.
Absolutely.
Okay.
So by going in and doing, just some gentle techniques to the pelvis, both addressing the structural part, the hard bony stuff with adjustments, as well as releasing the muscles and ligaments around the pelvis, will help to open things up, get the baby to drop down a little bit further, get him nice and cozy in that good vertex position that we want, get the pressure, get the dilation going, and get the labor
and have a baby.
Yeah.
Because that's the ultimate goal, right? Well, with that being said, are there any warnings or any cautions that pregnant women should take during either, pregnancy or birth adjustments?
Cautions as far as actually having an adjustment?
Is anyone not a good candidate for an adjustment?
So chiropractic is totally safe for pregnant women. I can't say that there's anybody that is not a good candidate for an adjustment. There's many techniques. A lot of people associate chiropractic with a big, forceful, loud cracking
Right, we hear
noise.
that a lot. I'm going to go get cracked.
Right, and there's many different ways to achieve what we are trying to do. Without having to use a lot of force, without having to use, the big cracking sound. You might have a woman, that is osteoporotic for whatever reason, and there can be argument that maybe they're not the best candidate for a manual adjustment.
Mm-hmm.
But again, there's many different techniques. Just like there's many different reasons that women have low back pain. There's a technique for everything.
For every ailment, right?
Right.
What about someone who maybe has had back surgery, and maybe there's rods or something in their back, or they have like severe scoliosis? Because these come up when moms are thinking about getting epidurals, right? Because that's kind of on the forefront. I don't know if I can do it with or without. So maybe they're not a good candidate for an epidural, but with this adjustment and setting them up for success and knowing that they can tolerate labor because it may be shorter, are they not a good candidate for chiropractic?
I've seen many women with Harrington rods pregnant,
Mm-hmm.
and they respond really, really well. And when someone has Harrington rods, we're not going to put them in a side posture position and, you know, give them a lot of force through the joint to get that big cracking noise. We're going to use gentle techniques. We're going to mobilize things. We're going to use the muscles and ligaments around to do some of the work. They're not going to get the same kind of treatment as, you know, say a very athletic woman that doesn't have scoliosis, no Harrington rods, anything like that. The treatment's going to be different. It's specialized. It's for their body.
Now, here's another thing that I've seen as a doula for over 15 years. My Pilates instructors, my dancers, the very active, maybe even the ones that are doing CrossFit, right? So everything that we want them to do is to release this part of their body so that they can allow that baby to do what it needs to do. Are you seeing that in chiropractic too, where kind of, I mean, they're strong.
They're very strong. It's tough. They're tougher to treat, but not impossible. And they can benefit from treatment because they, you know, in their sports, they know to, you know, flex the hip for everything that they do. Everybody tells them, go to prenatal yoga, do this pose, do that pose, Pilates. You have to be active during pregnancy. You know, exercise is wonderful for pregnancy, and they don't think that, well, that's for the endurance factor, not that you need to be, you know, an athletic machine to be able to have a baby. So with, you know, women that are very athletic and active, I do a lot of stretching with them. I teach them how to stretch those muscles that are problematic for them because they're very overworked based on their activity level, that most of the time they've, you know, been athletes for 10 plus years, and they may not realize that they need to stretch some of those things. They might have a stretch that they already do, or maybe a coach showed them, but it's not isolating the specific muscles and ligaments that we need to loosen up to be able to have a better baby.
Because I often encourage my clients to talk more about this with their care providers, and almost encourage them to do more yoga in the stretching aspect instead of the tightening aspect. So we're on target with that, right?
Yes.
Because it's so important.
Yes.
What about a breech baby? Because that's a big complaint for a lot of families, right?
Yes.
That first baby's breech.
Yes. Breech babies, there's a lot of reasons babies go breech. A lot of sometimes they're anatomical things. They're things that we can't change, things that no amount of chiropractic care will be able to alter. If you have a placenta that's in the way, if you have a cord that's too short, if the fluid level isn't quite right, that baby just may not come head down. But when you have constraint in the uterus based on, you know, muscles and ligaments and, you know, postures of the women, and we're able to release those, most of the time we can create enough space in the pelvis to get the baby to naturally turn down on their own. Babies like to be with their space.
So you want to encourage baby to turn. It's not like you're forcefully.
No, we're not. It's not an ECV. We're not manually manipulating the baby, you know, doing a forceful procedure to force your baby down. All we're doing is opening up the pelvis, creating space so that your baby can come down on its own.
Yeah, and I had the most amazing story shared with me as a labor doula trainer. I was training this whole group of women, and one of the students was planning a home birth for her third baby. She was raised in a completely natural environment. Her mom had been a La Leche leader for many years. So it was a home birth. She was going to have a midwife. And in labor, her baby completely flipped to the breech position. So, of course, the midwife says, we need to transport. We're going in. And at first, the family's devastated. They have to kind of mourn the loss of that original birth plan that they had envisioned. And she did end up with a C-section, but this is the amazing part, and this is why I say we trust babies, that they know. So if they're not turning, there's a reason. This baby was born, and all 5 bony platelets were already fused.
Oh my goodness.
So that baby said, it's not safe for me to be born this way. It's not safe for me. It's not safe for my mom. So I need to let everybody know we got to go a different route.
Right.
So we do have to trust in the process too. So certainly we want them to try all of these things to encourage baby to get where they need to be. But it's not the be all fix all to fixing everything, right? Some things don't need to be fixed.
And we're not trying to fix anything in that sense either. We're just trying to give them the best chance to have an optimal labor and delivery. We're not, trying to, dictate how they're going to birth their baby. I always tell women that come in to go into birth with an open mind because it may not go the way that your birth plan says.
And I'm so glad that you said that because there's going to be a whole nother segment. Okay, I'm just going to go on record as saying I'm not Ellen DeGeneres. I am not a professional. This is raw. It's going to be uncut, unedited, so you're getting it straight from here. But there is going to be a segment on birth plans, right? Because a lot of care providers are like, well, you can come in with a birth plan, but you're not going to get anything on there because it's going to go the complete opposite. Many years ago, I got away from calling them birth plans. We always call them a birth preference. That says, provided everything's going well, here are some things that we as the parents would prefer. And I think so. I do think that's important that you mentioned that. Is there anything else that we didn't cover? Because we talked a little bit more about like nausea, right? We talked about, what else? I have notes here. Sciatic, which we covered, baby alignment. What are some of the other things that women can come in to see you for?
So, rib pain and pubic bone pain is a big one. It is one of the most painful conditions that I see for women. It hurts me sometimes to treat them because it's not a comfortable treatment. I'm getting into some areas that are very, very tender,
And probably never been touched before, right?
Well, maybe in, the ribs and the intercostal region, but when we're getting, really close up into, the pubic bone, there's, areas where there can be trigger points that develop, and it can refer pain all across the pubic bone. A lot of times women will come in and, they'll say, oh, this is absolutely my pubic bone. I went to a physical therapist. They told me to do all of these stretches. But what they don't realize is that they're making it worse sometimes doing the stretch. Pubic bone pain, I oftentimes see it related to the muscles of the inner thigh.
Okay.
So when those muscles
which are directly connected, right?
Right, directly connected. So when those muscles are really tight and you're putting more stretch on them, it's just pulling more on that pubic bone. And they can't figure out, why when they went to physical therapy and, they were having all these stretches done, and why in prenatal yoga all these stretches aren't helping this tight muscle that they were told they have. It's not resolving. It's because the muscle needs to be released, not constantly stretched.
Now, we know somebody in common who recently was treated by you, and you kind of told her the opposite of what you tell a lot of people, right? You were telling her keep her legs closed.
Right. So with pregnant women, they're often told, open up. The main thing, open up. Not with pubic bone pain, because what you're doing is you're opening up and stretching those muscles that are putting the pull on the pubic bone.
Okay.
So for the most part, opening is perfect for pregnancy, but not for a pregnant woman with pubic bone pain.
Yeah. Okay. See?
Yeah.
So it's not all black and white. Like,
no,
there's
it's
a little
not.
bit of gray.
Right.
And I love that you're treating the individual. And I know both of you. I know how you both practice. You're not going to be telling women to come in because you need to see them 5 times a week, for the next 6 months. That you're going to help treat whatever's present at the time. And that's what I love about you guys. So I appreciate that. Is there anything else you wanted to add?
The rib pain, that's another one. There can be many reasons for rib pain as well.
Okay.
Sometimes there's pulling from the abdominal muscles.
Mhm.
As the belly's growing and things are stretching, you're going to get a pull on the bottom of the rib cage, and women will start to get pain for that reason. Sometimes they're having rib pain because it's coming from the mid-back area, secondary to breasts getting larger.
Mhm.
So there's not, one reason for rib pain either. Rib pain, the OBs will say another, we can't really do anything about it. You have to wait till after the baby drops down and isn't so close to the ribs, everything will feel better. But there is treatment for it. We can treat it. Sometimes they start to develop little tiny trigger points in between those intercostal muscles. And if we can get through and strip those, it's not comfortable, but they immediately feel relief after.
Yeah.
So.
And my mom said when she was pregnant with me a couple of years ago, because I'm not that old, is that my fingers actually got caught in her rib cage when she was pregnant with me.
Wow.
Imagine that,
Yeah.
right? She's like, that was the most uncomfortable.
Yeah.
Do you guys often also refer to other professionals like acupuncturists and stuff like that?
Yeah, I often will co-treat with an acupuncturist if there's a breech baby. Some women will benefit from having a combination of chiropractic care, moxibustion, acupuncture. The results seem to be a little bit better. So usually I will refer out for that.
And we talked a little bit earlier, like about the Webster Technique too, because that's something that people are really familiar with.
Right.
And you were saying in your practice that there's some variations of that. It may not be strictly the Webster Technique, but there, depending on what's going on, will be a variation of that.
Right. So there is a Webster protocol, which I'm certified as a Webster Technique provider. But again, with every woman, I don't just say, oh, breech, let me check off the Webster box. This is what you get today. I, assess them and check to see, what is the most effective treatment for you? Do I need to do all of the components of Webster, or, do you only need these pieces? So I guess technically I'm not doing Webster when I practice that way, but I do definitely hit the components of Webster when they're necessary.
Fabulous. We appreciate you. My clients appreciate you, that's for sure. All right, so we traveled through that part of the process, the amazing process of birth, right? So let's go into newborns.
Sure.
Because you also treat pregnant women, right? You're going to start getting more familiar with treating women in labor, right?
Yes.
Because that's uncharted waters for you.
Yes, it is.
Okay, so you know pregnancy and you know newborns, but that's an area that maybe, unlike Yvette, that's where she's kind of done most of her stuff.
Exactly.
So let's talk about newborns. Why do newborns need adjustments?
Well, oftentimes we've all heard about birth trauma. And a lot of the studies that are out there, in fact, most all of the studies that show children who have all kinds of symptoms that occur after they've been born, you just think of your typical baby and you think, oh, that's just normal. Well, oftentimes it's actually due to birth trauma. And we don't necessarily say, oh, they had a traumatic birth. I mean, come on, birth is traumatic. So whether it was actually a clinically traumatic birth or they just were born, it's still traumatic. And so
it's traumatic on the body for the woman.
It is. I mean, if you think about the growth plates in their brain, in their skull, and as they're coming through the birth canal, they're all having to, squish and move to get the baby's head through. And so as they're coming through, sometimes the cranial bones, those sutures, aren't quite in their normal position where they should be, and that can really begin to allow for some pressure to build up around the brain, which can, trigger some neurological things that can happen. The thing that is really important to understand with everybody, whether you're a pregnant mom, a dad, a child, a newborn, whatever, your brain and your spinal cord controls absolutely every single function of your body. And if that is compromised in any way, then we begin to see ramifications of that. That's just normal. I mean, if you think about you had something to eat for lunch today that wasn't very healthy for you, what ends up happening? You get a stomach ache or you don't feel so good. These are ways that your body communicates to you that something isn't quite right.
Okay.
And so that's how your brain communicates then through the spinal cord and all of the nerves in your body to alert you to problems that are happening in the body. And so when we think about that in terms of newborns don't have a way to tell us something's not right.
Mm-hmm.
So we have to be able to pick up on a lot of the cues that we get from them. So if we have a fussy baby, and when we say fussy, we mean unconsolable, they're not acting right, when they cry, they're just like wailing crying,
Very
and it's
irritable.
and it's a very like, something's not right, this baby is in pain. Things like they're not sleeping well, they're not sleeping the normal length of time for a normal newborn, or every stage. I mean, and that changes within days, you know. So are they progressing at normal growth patterns, and is their developmental skills appropriate for their age, and all of those things. These are things that we look at, that we assess when the babies are in the office. We want to see, what is their growth, is it happening normally, and then what are the stories that mom and dad are telling us about why they came in.
Do you ask their birth stories?
I do.
Yeah.
I do ask their birth stories. How long was labor and delivery? Were forceps used? Did you have a vaginal delivery, or did you have a cesarean? You know, what kinds of, all kinds of things. Did you have pain while you were carrying the baby? What kinds of preterm conditions did you have? What was your labor and delivery like as a mother? A lot of studies are showing that epigenetics plays a big role in not just your health, but also the health of your baby. What was your womb experience like? Because that affects your baby's womb experience.
And they're
in the
tracking
future.
it back 10 generations.
Yes, they are. And the studies going forward are quite grim, and so we won't get into that today, but it is very scary as we think about the future health of our children. So one of the things that I really encourage patients and anyone that comes into my office is to make sure that you're giving your baby the best healthy start possible. And one of the best ways to do that is with maintaining and ensuring the integrity of the brain and the spinal cord. And you do that best through chiropractic care. And oftentimes people go, man, I'm so scared. I don't want my baby to be adjusted. I don't know, is that safe? Is it not safe? And I will say, we don't adjust babies like we adjust adults.
Right.
They're babies. You don't feed a baby like you feed your 5-year-old child, right?
Yeah.
So everything's different, and we scale everything according to their age, their developmental levels, how strong are their muscles and bones at different stages in their growth. So everything's different. In my office, we use different techniques.
Now, you're a big activator user.
I am.
And what does that mean?
I am certified in a technique that is an instrument adjusting technique called the activator. Activator is a low force adjustment. It's very, very, very comfortable with newborns and early, even up to about a year. I don't even use the activator on them, because even still, that's too much force. So, I mean, if you can think about that, an activator, the force is like a little click, click. And even that's too much to use for an infant and a newborn. So at that point, we're using very light, very soft toggle adjustments that are similar if you think about like trigger point therapy. You hold and you just gently press on an area where we're
like
finding
2 fingers or
subluxations.
something, right?
Exactly. It's very, very light. For instance, if we have a little baby here. This baby was born. So when this way.
Through this pelvis.
There we go, baby through the pelvis. So this baby's been born, and let's say your baby's coming in and you're like, the head's kind of turned like this all the time. This is forward, but the baby's head's kind of like this and maybe tilted a little. And you're like, but it's not laying right. It's not sleeping well. It's fussy a lot. I don't understand. Maybe the eyes aren't tracking properly. We've got one eye kind of wanting to float off a little bit while the other one stays forward. Sometimes they're having issues with screaming and they're bringing their little knees up when they're crying. Other times they're having issues where you're starting to see a bald spot develop on the back of their head. These are all things that we look for that are signs, clinical signs, that we have some issues going on in the spine. So the most common places that we see subluxations, that's a big word, but that means basically spinal misalignments, of the bones in a spine or in any joint. The most common places that we see subluxations are typically with children when it regards things of the head is going to be more in the neck, so and mostly going to be upper cervical. If they're having issues with digestive problems or even sometimes sleep problems or the fussy, that's like the screaming, crying, and all of those things, then
so like when you talk about digestion, is that like a baby who is constantly spitting up, even if they're breastfed babies, and we know they're not overfed for the most part?
So the spitting up accompanied with unconsolable crying or all of a sudden screaming crying that's like it came out of nowhere. Projectile vomiting is another one. Excessive bowel movements that tend to not look like a normal newborn bowel movement. They're very watery, they're very explosive, a lot of screaming and crying that is indicating that it's a painful cry, not just I'm a hungry cry. Those kinds of things are indications that there's something going on in the digestive system, and it could be anywhere in the digestive system. So what we look for then would be areas in their spine, most commonly in their middle to lower thoracics, where they're having some issues there, as well as around the sacrum, which is the base of the spine. So you think of that as your sits bone, the big bone in the butt. And so when we see lower lumbar issues as well as upper cervical, these are really the most common areas that we're finding issues with newborns when they're coming out, firstborn.
And this area is that, like, when I get moms all the time that, oh, my baby loves to eat on the left but won't eat from the right breast.
Right.
And we know they're not making chocolate milk on one or regular milk on the other, right?
I don't know.
but doesn't it in fact like hurt for them
Absolutely,
to turn that way?
Absolutely. Well, think about this. Hold your head in this position for a while.
No, it hurts.
Okay? You do that for 12, 14, 16 hours. Think about when you've been on, the last time you've been on an airplane and you were sitting talking to the person next to you and how sore your neck was after that flight. That was maybe a 4-hour flight.
Or moms that are breastfeeding are constantly looking down.
Right, exactly. Okay. So you've got your mind around this position, right? Now imagine you're born and this is the way it's been now for a month. Even if it's 2 weeks, that's longer than 4 hours.
I'd be grumpy.
You'd be real grumpy too, right? But it's usually, you've heard the word torticollis. Oftentimes a congenital type of torticollis like this, meaning that it happened at birth or during the birthing process, that this can be due to just some excessive muscle strain that's happening on this side that's pulling the head into this position. That's also quite commonly the muscles are spazzing and straining due to when they were born. Sometimes they get stuck, and if you've ever seen a birth in hospitals, whenever they are in this whole thing, and baby's head is really getting twerked around. When that happens, that's putting excessive strain and pressure on the cervical spine, and especially the spinal cord, and so that can create some subluxations in that upper part of the cervical spine. When that happens, all of your muscles everywhere in your body ultimately are attached back to your spine. So when we have this kind of torquing and happening, so now you've got bones that are displaced from their normal position. You have muscles that spasm to protect ultimately the brain and the spinal cord. And so now they're holding in a pattern that is creating this abnormal position for the baby's head. So that can create some discomfort. But the thing to understand is, okay, so the baby has pain, but why? It's because of these abnormal positions that the nerves, as they exit the spinal cord, because those are like your electrical plugs, right? The plug from your lamp goes into the electrical outlet. Think of your spine as the outlet. You plug in the electricity there, right? So as they're having issues with digestive problems, they're having issues with bowels, they're having issues with torticollis, ear infections, lagging with the eye patterns and the movements that way. All of these things are due to what we call subluxations and the interference then that is put on those little electrical circuits as they then control the function of those end organs.
Okay. Is there ever a time where a newborn should not be adjusted? Where you would go, I'm not doing this one?
Well, of course. I mean, I'm not going to adjust every single baby and say every single person on planet Earth is a candidate for chiropractic. Right. I would say you're probably more likely a candidate than not. Okay. So, yes, there are certainly ways that we would need to be careful. Just like Dr. Castro said, there are so many different techniques that are utilized in chiropractic. I mean, I know even patients who have cerebral palsy. I've not particularly had a patient in my practice with cerebral palsy, but when I was doing rotations, I did. And so there are techniques that we use to gently adjust for those things, but we're not doing the hard side-lying, racking, cracking kind of movement that everybody kind of says, oh, and yeah, I'd be afraid too if I'm going to put that on a child, a little baby.
So this is a more gentle approach to, like, because I know if one of my clients goes in and they talk to their OB because maybe baby does have torticollis,
right.
The first thing they're going to say is physical therapy.
Right.
And physical therapy, I've seen, although it has its great benefits,
sure.
takes a lot longer
yes, it does.
time to really help with that particular ailment versus maybe chiropractic. So you're saying it's another gentle approach.
It is. For instance, I'll just show you, because oftentimes people go, oh, it's too afraid, I can't do it. So I'm going to hold this is the baby's bed, okay? The baby's laying on a bed or on a table. When I'm looking for a child with torticollis, let's say their head's turned this way, okay? I'm looking to feel upper cervical. It's so gentle. I mean, you could feel it yourself if you know what you're feeling for. You're just feeling for movement in the spine. I mean, and if you can see, I'm barely putting pressure here. You can't hardly feel it. So,
I can barely even see the movement.
Right. So when I apply the pressure, let's actually make the head go this way. Let's say they're this way. So when I'm applying the pressure, I'm looking for the side where the subluxation is, which is, on this case, we're going to say it's over here. So if it's here, I'm just going to gently apply pressure. I'm not digging in and getting my finger in there. My hands are turning white. Just gently applying that pressure, waiting for the body to relax, the muscle to relax. And then oftentimes, all of a sudden, the baby will just kind of go,
yeah, I've heard
that's what I'm looking
it.
for. And when that happens, you start to see a little bit of movement. And in some cases, you see a complete
oh, there you are. Hi.
Thank you. That's what I wanted to see happen. My head's moving now, right? But that's all them doing that. So it's just this little gentle, tiny pressure. We allow for that to happen, and then the baby moves on its own.
Okay.
So, but we're waiting really for that breathing pattern to change. And then sometimes you'll hear or even feel, mostly you'll just feel a little, just a little release, and it goes right back to where it's supposed to be, and the baby, its health is restored.
Does it stay in place, or does that require a couple different treatments?
It most often requires a couple different treatments, because muscle, as we know, has memory. And so oftentimes parents will get frustrated because they're like, I don't understand, you fixed it and now it's back again. I liken all of this, and I talk to adult parents the same way. I said, look, chiropractic care of the human spine is much like potty training. Think about that. If you've had a child, or you've had children, like siblings, that you've helped to potty train, it doesn't happen one time. You can't say, okay, little Susie, I want you to come over here, and this is the toilet, and I want you to go potty right here. And then you set them down, and then you walk away and expect them to pee. No. Chances are you're going to go back, and they're still going to be sitting there looking at the magazine, and they will yet have gone to the bathroom. So you teach them, okay, it's time to go potty. And you keep doing that until finally one day they're like,
yep, I got it.
I peed, right? And then, but then you don't stop there, because do they continue to do that? Not usually. Usually you take them back multiple times over and over again. So I always say chiropractic is like potty training. Sometimes it happens the first time, but most of the time we need to see them a few times, sometimes several times, depending on the severity of the situation.
Because you're just reconditioning the body to
Absolutely.
go, oh yeah, it feels much better to stay in alignment.
Right.
Okay.
Exactly.
What are some of the other successes that you've seen?
Another success is with babies with hearing issues. Oftentimes that's a scare, and if you've had your baby delivered in the hospital and they do the hearing test and they come back and they say your baby didn't pass the hearing test, we'll do it again in another day, and we'll see, or another 2 days, and we'll see how they're doing. Then they come back and then they say they didn't pass again, or they come back and say they passed. Okay. But then you start to notice when you get the baby home, it's like they don't always seem to hear you as well out of one ear, and maybe even for you as an adult, that's the same issue. Usually that's a result of something going on in the upper cervical spine as well. All the upper cervical spine, the upper part of your neck, is so critical to your overall health, because that is the very first vertebra that is where the spinal cord exits the brain.
Ah.
So if there is compromise there, it's not where it needs to be, then we start to see problems. So hearing oftentimes can be restored early on with children. Now, if it's something where there was a developmental problem with the ear, then that's not probably going to be changed.
Sure.
But if it's due to a subluxation,
Mhm.
we can see those things change. Other things are bedwetting as they get older. Usually that can be related to, sometimes it's the foods that they're eating. And as chiropractors, we don't just look at only the structure. We look at neurology. We look at their the function of their gastrointestinal system itself, as well as nutrition, and how is the foods that they're eating, the environment that they're in, all these things, how are they affecting the health of their gut, and how that then changes their body chemistry. And so there's many, many different things, but most common, I'm just going to get my list so I don't miss some of them, but some of the most common things that we see associated with children having issues with that need chiropractic care and that really can benefit greatly from that are some of the symptoms would be pain that we've already talked about for moms during pregnancy and after labor and delivery, just helping with the recovery period. Breastfeeding issues, we've already kind of spoken about that. The fussiness that's associated with the gastrointestinal issues and sleep problems. Ear infections, we talked about hearing, but also with regard to ear infections, sleep patterns and behavior as children are getting older. There are some really great studies done with regard to sleep and behavior even not just ADD and ADHD, though that is a very common reason why people seek out chiropractic care, but just he won't sit still. He doesn't have ADD, he doesn't have ADHD, I can't even talk. He doesn't have ADHD, but he's like, he just won't stop, or he's aggressive. He's like, gets mad and he's just explosive instead of being able to calmly speak with him, you know. I mean, he's still a toddler, okay, but it's abnormal. Little things like that. These are things where we're looking to the spine for what is the cause of these symptoms that they're having. We've already mentioned the torticollis, the gastrointestinal system, vision, headaches. For me personally, I'll give you a quick story for me. When I was born, at the time, my parents didn't know till I was much older, but my mom would find me as a baby beating my head on a crib, crying and crying and crying. And she was like, Mindy, you were inconsolable. We did not know what was wrong with you. We took you to the doctor. They wanted to put you on Valium. Oh my gosh, as a baby. What? And so as years went on, we were finding that I was actually having headaches, very bad headaches. And as I got older and older and older, of course, they became excruciating, and it's actually why I became a chiropractor.
I was going to say, you guys have a story.
That's my chiropractic story. But what we ended up finding, and I didn't know this till later, and this is where I urge you as parents to really consider the health of your baby's spine. I did not know till I was 33 years old. Now that's 33 years of this, of extreme migraine headaches where I was missing school for a week or more on end, and all the nausea and the vomiting and all these things that would come along with it. I did not know that all of it could have been prevented and, well, reversed initially, obviously, and then completely prevented had I been to a chiropractor. My upper cervical spine, C2 and C3, were so badly subluxated that it basically was creating like static information from the brain through the rest of the body. And C2, C3, by the time I was 33, were so degenerated, they looked like something you would see in a 60-year-old or older. So that kind of degeneration. And so bone on bone, lots of bone spurs, that's a common word you guys know, where all these bones were together. And so that grinding, every time I would move, would put all this pressure on these nerves. And over time, then that gets worse and worse. And so little things like this, headaches, vision problems, I had vision problems as well, started getting adjusted, and it all went away at 33. So if we can prevent that, and we can improve the health of our children, we then, as parents, don't have to take out so much time off of work if we're working. We get better sleep at night. The babies are getting better sleep. They're also...
Our hearts are more peaceful because we know that they're not... Like our innate, built-in mechanisms there. We want to
Right.
fix it, but we don't always know how because we've been to doctors, we've been,
Right.
through what we consider the norm now that we
Right.
didn't know we had options.
Exactly.
So I'm glad that's being
Yeah.
talked about for sure. How did your journey begin?
So I grew up pretty much on the alternative path. Didn't take a lot of
Okay,
medications.
can we talk about alternative for a
We
second?
can, yeah.
Because people call it alternative
They do.
now, but
It's the original.
right. This is what people were doing hundreds of
Yes,
years ago,
yes.
and from that
Right.
developed what we consider the norm now. Okay, so
right.
you were brought up on the original,
the modern
alternative.
day,
The original
alternative, which is
alternative.
actually the original way that
Right.
people were treated. So I did grow up that way. Didn't do a lot of medical doctors, medications, things
Mhm.
like that. We always did more natural
Mhm.
approaches to care, and I just always kind of went that direction.
Yeah.
And it's hard to be in a profession and not be one with it and truly believe in everything
Mhm.
about it. And I feel like with chiropractic, I have all of those pieces. Where there's some things with allopathic medicine where it's like, well, I'll take this, but maybe not that, and I'll take some of this, but maybe not that. I don't feel like that with chiropractic. I feel
Mhm.
You
like
feel it's an all
Right.
Yeah.
encompassing.
Yeah.
I cannot appreciate you guys more. I refer my clients to you. I want them to get the best care. I believe in it myself. I've had it. I'm going to start being treated again because I want to feel good so that I can serve my clients, because it is kind of a waterfall effect here. Is there anything else that you two would like to add that we didn't touch on today? Because we'll probably do a follow-up segment at some point too. But
Sure.
did I forget anything?
I think you covered everything really well.
Yeah.
So how can people find you? Because again, we're in Southern California, but this is going to be viewed all across the U.S. And I'm sure you guys will have resources in other states.
Sure.
But where are you located?
So I'm in Long Beach, California. Bayshore Wellness. Do you want my phone number?
Well, yeah, put that out there for everybody.
Right.
But do you have a website?
I do have a website, www.bayshorewellness.com.
Fantastic. And Mindy, who just moved into a bigger office, so you could treat so many more people.
Yeah. We've actually moved. We've been growing rapidly, and it's exciting to see. The name of my practice is Brio Wellness Center. Brio is capital B-R-I-O, so it's Italian. Brio Wellness Center, and we're actually located in Los Alamitos, which is right next door to Long Beach. And the website is briowellness.com, and you can look us up there, and all of our information to contact us and get in touch is on the website.
And I have no doubt you guys would be amazing resources. Again, even if it's people not in the general area, they can reach out to,
Absolutely.
and I'm sure you'll get them in touch with really great people. So thank you again for tuning in to the Doula channel. We'll have many more segments like this, so stay tuned. We'll see you then. Bye.
Bye.